The government is eyeing to impose a ban on travelers from more countries due to the new variant of COVID-19. But these new travel restrictions might be too late, as an expert raises the possibility that the new strain has already entered our borders. Greg Gregorio with a report.
Malaki po ang problema, pinaluhod ng COVID-19 ang buong mundo, no? At tayo, kailangan natin talaga magkaisa dito.
This is what Health Chief Francisco Duque III has to say almost a year into the COVID-19 pandemic. During the year-end presser of the DOH, Duque has admitted that there were missteps in the government's response to the health crisis.
Tama ho, may mga missteps, may mga pagkakamali, pero yung mga pagkakamaling iyan ay nagsisilbing mga leksyon para lamang mas maging matagumpay ang tugon sa COVID-19.
In his defense, the health chief explains that we have to consider that the health situation is unprecedented. He goes on to highlight the government's efforts, including the increased testing capacity involving 199 testing laboratories. Duque also notes that more beds have been allocated for isolation facilities and hospitals across the country. He adds that the government has hired and redeployed thousands of healthcare workers. The official then vows to continue ramping up their efforts against COVID-19 come 2021. Duque says that DOH will in fact impose travel restrictions in more countries such as the United States. That is, if they have already reported to the World Health Organization their first case of a new COVID-19 variant.
Yes, that's the policy. Any country that has reported the new UK variant will be subject to the temporary ban.
But Dr. Nicanor Austriaco of the UP Octa research team says that the B117 variant first detected in the UK might have entered the country already. In an interview with one PHS sa Totoo Lang, Austriaco explained that it possibly came from Singapore.
So if it arrived in Singapore December 6th, and we only close our borders on December 24th, that leaves 2 weeks for balikbayans from Europe and from England to return home. So I am sure it is likely that it's already here.
But the DOH assures the public that actions are underway to verify the presence of the variant.
The Philippine Genome Center, the RITM, and the National Institutes of Health are already starting to do their genome sequencing just to identify if this variant is already here.
Meanwhile, Duque defers giving more comments on the unregulated vaccination among members of the Presidential Security Group.
Antayin na lamang natin dahil magsasagawa ng investigasyon ang FDA at kasama ang Bureau of Customs.
For News 5, Greg Gregorio, we are One News.
Returning Filipinos continue to arrive at the Ninoy Aquino International Airport on the first day of travel restrictions to countries affected by this new COVID-19 variant. Many of them are disappointed as they'll have to spend the New Year alone during the mandated 14-day quarantine. To give us more details, Gerard de la Peña reports to us live from NAIA Terminal 3. Gerard, good afternoon. How are the passengers taking this?
Well, Charles, today is the first day of the implementation of the travel ban against countries where there are reported cases of the new COVID-19 variant. And passengers are bracing themselves for the mandatory 2-week quarantine. Well, Charles, travel restrictions on 20 countries, including the United Kingdom, would mean stricter protocols for Philippine passport holders who have been allowed entry here. RT-PCR testing upon arrival remains, but those coming from these 20 countries, including those who only had a layover, will be subjected to a 14-day quarantine, even if their swab test results turn negative. The Philippine Coast Guard will help ferry arriving passengers to their respective quarantine facilities. There's a handful of international flights arriving today. Among them is a flight from Hong Kong. Many of them dread the 14-day quarantine as it means they will spend the New Year alone. The Overseas Workers Welfare Administration is worried that the mandatory 2-week quarantine would result in shortage of facilities for arriving passengers. OWA is hoping that Middle Eastern countries will not be included in the ban as arrivals from the region make up 60% of the daily count. This will also surely have an impact on the availability of isolation facilities. Transportation Undersecretary Raul Del Rosario says more countries may be added in the list if they report cases of the more infectious COVID-19 variant. Charles, foot traffic here at the NAIA is far different from the previous holiday seasons that we have covered, and the Manila International Airport Authority confirmed this, saying that passenger volume here right now is actually less than 1/4 of their usual. And the government is capping the number of arriving passengers to just 2,000 daily from the previous 5,000, and that is meant to ensure the availability of quarantine and isolation facilities for arriving passengers. Charles.
All right, Gerard, tell us, other than in New Clark City, where else can passengers stay for their mandatory 14-day quarantine? Are they also allowed to stay at the designated hotels?
Yes, Charles, they are allowed to stay in other designated hotels. The original plan actually is to bring arriving OFWs and Balikbayan Filipinos to the New Clark City, and that was the time when the only one on the list is the UK. But now we have 20 countries, and for sure, the number of arriving passengers won't be, the number of isolation facilities in the New Clark City won't be enough to accommodate all the passengers. So now the government is allowing passengers to stay in any accredited quarantine facilities, including those here in Metro Manila. Charles.
Thank you, Gerard. That was Gerard de la Peña reporting live from NAIA Terminal 3. The Health Department reports more than 1,000 new COVID-19 cases on Tuesday. Confirmed cases now stand at more than 472,000, more than 23,700 of which are still active. Quezon City has the most number of fresh infections today at 67, followed by Benguet and Makati City. 68 people died of the virus overnight, pushing the death toll to around 9,200. Total recoveries now stand at 439,000 as 500 more patients got better over the past 24 hours. The UP Octa Research Group says the country is still in the third wave of COVID-19 infections despite the recent decline in fresh cases. Father Nicanor Austriaco tells Sa Totoo Lang that the post-holiday surge will likely be reflected once people start going out and testing laboratories resume operations.
Before the holiday, there was a wave. It was going up. There is nothing to think that we have stopped the wave in 2 days. So the most likely explanation is that the testing centers are simply on holiday and the hospitals are on holiday.
We'll have more stories after this short break. Stay with us. You're still watching One News Now. I'm Charles Lejano. Defense Secretary Delfin Lorenzana seeks the explanation on the unregulated vaccination of some personnel from the Presidential Security Group. He's calling on the PSG to explain to the Food and Drug Administration why they carried out the inoculation without following the regulations. Lorenzana acknowledges that the shipments, which he considers smuggled, were not authorized by the FDA.
Yeah, it's smuggled because they're not authorized hindi authorized magpasok dito. Only the government can authorize that.
Despite this, the defense chief believes that the move is justified since it is meant to protect President Duterte. The official promises that he will not allow another round of vaccinations without prior approval from the FDA.
Sa tingin ko okay naman epekto sa kanila to them so that they will not be infected at saka at the same time maprotektahan nila yung presidente.
The Health Department reiterates that only the FDA has the authority to decide which vaccines will be used. Undersecretary Maria Rosario Vergere is urging the public to follow existing laws to avoid facing various legal charges. This echoes the sentiment of some groups who expressed their disappointment in an interview with 1PH sa Totoo Lang. Robert Mendoza of the Alliance of Health Workers claims that the PSG vaccination violates the people's right to health. Prices of round fruits continue to go up as the new year approaches. Let's do some price checking with Shaila Francisco. She's reporting live from Makati. Shaila, how much money would a consumer need to bring to buy a complete set of fruits for New Year's Eve?
Charles, earlier I was able to buy a set of 12 fruits ahead of New Year's Eve for a total of 848 pesos. But just like any other consumers, I haggled with retailers as prices of the staple food items increased this week. At some markets in Metro Manila, retailers increased the prices of the round fruits by 20 to 100 pesos. Watermelons, for one, are now priced at around 200 pesos each compared to just 100 pesos last week. Aside from high demand, retailers say some fruit products were destroyed during the recent typhoons. With this, they still expect the prices to go up before the New Year's Eve. This won't stop some consumers, however, from buying round fruits as they believe that this will bring them luck in 2021. But given their tight budget this pandemic, most of them are opting for small pieces. To attract more buyers, some retailers are giving discounts, such as 3 for 100 promos for select fruits. They are also expanding their stalls along the sidewalks, much to the dismay of local enforcers. Officers from Barangay Public Safety Officers and local police in Quezon City keep reminding them to observe health protocols. Consumers who are not seen wearing face masks are asked to pay fines at the City Hall within 5 days. The Agriculture Department is advising the public to check out online stores for a much safer shopping. The agency says its Kadiwa stores offer food items at cheaper prices, both online and at physical stalls. Charles, the DA is also urging consumers to buy domestic product to help the farmers raise their income. Now, retailers, meanwhile, are preparing for another surge of customers tomorrow. Charles?
Thanks for that, Shaila. That was Shaila Francisco reporting live from Makati City. The Metro Manila Council has officially passed a resolution enjoining LGUs to enforce a firecracker ban. MMDA General Manager Jojo Garcia says prohibited fireworks include luces or all kinds of pailaw with dangerous powder. Garcia is advising those who want to hold community fireworks displays to secure permits from the National Police. The official warns that violators may face fines or imprisonment, depending on the ordinance passed by the LGU. PhilHealth is once again under fire, this time for increasing its monthly contribution rates to boost programs under the Universal Health Care Law. For some lawmakers, the state insurer should first answer the corruption allegations against them. Marian Enriquez with the story.
40-year-old Rian Grimares, who works as an account officer at a motorcycle shop in San Juan, Batangas, earns 12,000 pesos monthly. His company deducts 180 pesos from his monthly income, for his PhilHealth contribution. Rian is worried about a bigger deduction as the state insurer will increase its premium rate from 3% to 3.5% next year.
Kung magkano lang muna yung dati, di yun na lang muna dapat. Kasi medyo mahirap ang buhay ngayon eh. Tapos, ang sahod namin, 461 a day lang.
The adjustment of premium rates is mandated under the Section 10 of the Universal Healthcare Law. By 2021, those who have a monthly basic salary of 10,000 pesos and below will have a fixed contribution of 350 pesos per month, while those earning 70,000 pesos and above will have a monthly contribution of 2,450 pesos. PhilHealth assures Filipinos that this will be beneficial for them.
Each time na tayo po ay mga ilangang ma-confine, magpagamot, ay immediately eligible po tayo sa benepisyo. So hindi issue kung tayo ay may bayad, kulang ang bayad o walang bayad, wala na kung ganong pinag-uusapan. Immediately tayo po ay makaka-avail ng ating PhilHealth benefit.
The adjusted rates will ensure enough funding for programs under the landmark law. By 2021, the PhilHealth members will be assigned a primary care provider or healthcare professional under the program Konsulta or Konsultasyong Sulit at Tama. There will also be no co-payment or no balance billing for confinements in basic or ward accommodations in both government and private healthcare facilities. There will also be a lifetime coverage for all members reaching the age of retirement and after contributing for at least 120 months. But for some lawmakers, this may not be the right time to impose a hike on PhilHealth contributions. Senator Amy Marcos says the hike is a cruel and unusual punishment to PhilHealth members. She adds that the agency should first resolve the issues that continue to hound the institution. Senator Francis Pangilinan meanwhile questions what he calls an unbelievable increase when PhilHealth has been criticized for pocketing billions of pesos. While PhilHealth respects the sentiments of some lawmakers, Balenya is calling on the public not to lose their trust in the state insurer. For News 5, Marian Enriquez, we are One News.
For more updates, visit News 5, the Philippine Star, and Business World online. Visit our website, onenews.ph, for more in-depth analysis. And you can also catch One News on the Signal Play app. Register for a free account at www.signalplay.com and stream One News live anytime, anywhere. I'm Charles Lejano. We are One News.